What do you understand by lie? Lie is the relationship between long axis of the mother and long axis of the fetus. Right? Now, ideally when we are talking about lie, we should not say that it is the relationship between long axis of the mother and long axis of the fetus. Why? Because during pregnancy, uterus is dextro-rotated. Uterus ऐसे tilted होता है, right? So whenever I have to comment upon the lie, first thing what I have to do is I have to correct the dextro-rotation of the uterus. I have to bring the uterus in a centralized position, and then I have to comment upon the lie, right? So actually the right definition for lie should be, it is the relationship between the long axis of centralized uterus and long axis of the baby, right? So suppose if long axis of the mother and long axis of the baby are coinciding, that is longitudinal line, right? Mother ka long axis, baby ka long axis are coinciding. So that's a longitudinal line. If mother ka long axis and baby ka long axis are at an angle, that is oblique line, right? And if mother ka long axis and baby ka long axis are at 90 degrees, that is transverse line. Now whenever there is transverse line, you should always do a cesarean section, irrespective of the fact whether the baby is alive or whether the baby is dead. In case of oblique lie and in case of transverse lie, always and always management is cesarean section. Have you understood what is lie? Right? Then comes the second terminology, which is presentation. What is presentation? Presentation is that part of the fetus which occupies the lower part of the uterus, right? So if head of the baby is occupying the lower part of the uterus, it is called as cephalic presentation. And just now only I told you why cephalic presentation is the most common presentation. And please remember, cephalic presentation is the only normal presentation. Right? Agar cephalic ke alawa, if you are getting any other presentation, that will be called as malpresentation. Right? That is called as a malpresentation. And because the most common lie is longitudinal and cephalic presentation is the most common presentation, so breech becomes the most common malpresentation. So if buttocks of the baby are in the lower uterine segment, that is called as breech, and that is what is the most common malpresentation. Have you understood? Yes. Now, if baby is lying transversely like this, if baby is lying transversely like this, right? Then which part of the fetus is facing down? Shoulder is facing down. So in transverse line, what is the presentation? Shoulder presentation. So whether I say transverse line or whether I say shoulder presentation, it's one and the same. And what is the management in shoulder presentation on transverse line? Cesarean section, whether the baby is alive or whether the baby is dead. Right? Now, why am I saying that in transverse line you always have to do a cesarean section? Why? See, understand. All of you know that during labor, membranes are going to rupture, right? So suppose it is cephalic presentation. Suppose it is cephalic presentation. Suppose it's a cephalic presentation. Now in cephalic presentation, when the membranes will rupture and the cervix is fully dilated, what is going to happen? The head of the baby will come down and it will close the mouth of the cervix and it will not allow the cord to come out. Right? Similarly, if we have breach. In breach, whenever the membranes will rupture, the buttocks of the baby will come down and they will close the mouth of the cervix and they will not allow the cord to come out. Right? Now see if there is transverse line. If there is transverse line and the membranes are rupturing and the cervix is fully dilated, there is no part which can come and close the mouth of the cervix. So the cord of the baby has to come out. Right? That is why we say maximum chances of cord prolapse are in transverse line. So in transverse lie, if you are attempting a vaginal delivery is not going to happen, but actually what is going to happen? Cord prolapse. Right? Now suppose this patient, she came to me and I said that listen, I will have to do your cesarean section. So she goes home and she tells her parents, her in-laws that a doctor ने कहा cesarean होना. And now the in-laws and the parents will say doctor तो ऐसे ही कहते हैं. We are going to show you to a dye. Now this dye sees and she says, oh, I am going to do a vaginal delivery. Right? Now vaginal delivery is being attempted. What is going to happen? Nothing is going to happen. Delivery cannot happen in transverse line. Membranes will rupture and the cord of the baby will come out. Now this dye is desperate. कि delivery तो करानी है, बोला है तो delivery तो करानी है, right? So she is going to take her hand inside and whatever part is easily pulled, she will try to pull it. And when she is going to take her hand inside, the part which can be easily pulled is the hand of the baby. Right? So she is going to bring the hand of the baby out. Right? But do you think still delivery will happen? No. This patient with the hand of the baby out, with the cord out, with the baby dead is going to come to you. And this is what is called as hand prolapse. Right? So if they ask you what is the management of hand prolapse and in which condition it is seen? It is seen in transverse line. And what is the management? Cesarean section. Clear to all of you? So one very important question which comes as an image-based question, and this is a very, very important thing which you have to remember. In hand prolapse, what is the lie of the baby? Transverse lie के साथ if you are seeing the hand, that means it's a hand prolapse and they ask you what is the next step? Next step is cesarean section. Now once in your image-based questions, in Marrow there was a question where the lie was longitudinal. The lie was longitudinal, right? And hand and head both were coming out like this. This is not hand prolapse. This is compound presentation. Two parts of the body are simultaneously coming out. Right? In compound presentation, what is the lie? Longitudinal. Right? And in compound presentation, if head and hand both are coming out, you don't have to do a cesarean section. Proceed with vaginal delivery. Gradually the hand will automatically go back and head will deliver. So if they show you an image of hand prolapse mein it is going to be transverse lie with hand coming out. And they ask you what is the next step? What is the next step? If they show you an image of transverse lie where head and hand are coming out together, that is compound presentation. And compound presentation may you have to proceed with vaginal delivery. Is that clear to all of you? I will show these images to you just now. Yes?
Do we push the hand back in transverse?
Automatically it will happen. In transverse lie, no, nothing. You have to do a cesarean section.
So cesarean, why the hand is out?
You will be able to, when you are pulling the baby out, the hand will come out. Right? Now comes third important terminology, and that terminology is presenting part. Right? Now for understanding the presenting part, you will have to understand that the skull whether it is your skull, whether it is baby's skull, is divided into 3 parts. Right? What are the parts of the skull? So first of all, I want all of you to put your finger approximately where your posterior fontanelle is. All of you. Approximate on your posterior fontanelles. And another finger of the other hand approximately on anterior fontanelle. Right? अब ये जो part of the head है, which is between your both fingers, this is called as vertex. What is this called as? Vertex. So what is vertex? Vertex is that part of the skull which lies between posterior fontanelle and anterior fontanelle. Now I want all of you to put your finger on anterior fontanelle. Same hand ki finger on the root of nose. This part. Now this part which is now between your fingers, this entire part is called as brow. It is not BRO, it is BROW. Right? Eyebrows. Right? Brow. Right? Now I want all of you to put your finger on root of nose and chin. This part. This part is face. Right? So any skull will have 3 parts. Vertex, brow and face. Okay? Now I want all of you to see. This over here, triangular shaped always is posterior fontanelle and diamond shaped is anterior fontanelle. So this part of the skull is vertex. Between anterior fontanelle and posterior fontanelle is vertex. Now between anterior fontanelle and root of nose, this part, brow. And between root of nose and chin, face. Right? Now let us see. When I do a per vaginal examination, suppose the head of the baby is fully flexed. Please understand. Don't turn it over. This is how the baby is normally in the mother's uterus. All parts of the baby are flexed, right? So when head of the baby is fully flexed, and when I am doing a per vaginal examination, where is my finger touching? Yes. Visible to all of you?
Yes.
Yes? So in a fully flexed head, what part does your finger touch?
Vertex.
Right? Now I am deflexing the head. Now I am deflexing the head. Right? Deflexing means neither flexed nor extended. Right? Now when I am doing a per vaginal examination, again vertex. Right? So this means whether the head of the baby is fully flexed or whether the head of the baby is deflexed. Which part are you going to feel?
Vertex.
Right? Now I am slightly extending the neck. Now when I slightly extend the neck, where is my finger touching?
Brow.
Right? And now I am completely extending the face. In complete extension, where is my finger touching?
Yes.
Have you all understood? Yes? So whenever the head of the baby is fully flexed, then which part does your finger touch?
Vertex.
When head of the baby is deflexed, then
Vertex.
when head of the baby is partially extended,
Brow.
and when head of the baby is fully extended,
Face.
Right? Now understand the terminology presenting part. What do you understand by presenting part? Presenting part is that part of the presentation which is first felt on per vaginal examination. So whenever I have longitudinal line and cephalic presentation and head of the baby is fully flexed, then the presenting part will be vertex. When the head is deflexed, the presenting part will be vertex. When the head is partially extended, presenting part will be groove. And when the head is fully extended, presenting part will be face. Right? So what is the most common presenting part? Vertex. Because most of the times, all the parts of the baby are flexed. Is that clear to all of you? Yes? Now, whenever there is bro presentation, then the diameter which comes into play is mento-vertical diameter. Remember this? So say it with me. Whenever it is bro presentation, it is mento-vertical diameter. How are you going to remember this? ऐसे ऐसे करके मत याद, कुछ नहीं याद रहता एग्जाम. रिमेंबर मूवी देखते टाइम हमारी आईब्रोज ऐसे होती है ना. सो ब्रो प्रेजेंटेशन मूवी एमवी. ब्रो प्रेजेंटेशन में व्हाट इज द डायमीटर? मेंटो-वर्टिकल डायमीटर. राइट? And mento-vertical diameter is the biggest diameter, 14 centimeters. Do you think a 14 centimeter diameter can deliver vaginally? No. जितना मर्जी cervix dilate कर जाए, it will be only 10 centimeters. Right? So a 14 centimeter diameter cannot deliver vaginally. So whenever there is bro presentation, you have to do a cesarean section. Clear to all of you? Yes? So bro में what is the diameter? Name? Right? एक bro का याद रखो. Another diameter which you are going to remember is vertex. Vertex में when head of the baby is fully flexed, then what is the diameter which comes into play? Whenever head of the baby is fully flexed, diameter. Again, how are you going to remember this? Have you seen babies crying? How do they cry? Like children crying. They flex their neck and they cry. Right? So when head of the baby is completely flexed, that is how they cry. Cry के लिए दूसरा नाम क्या होता है? Sob. So when head of the baby is fully flexed and you are getting a vertex presentation, the diameter which is going to come into play is sob. Sub-occipitophragmatic diameter. Sob. S-O-P. B for Bombay. S-O-P. Sub-occipitophragmatic diameter. याद रहेगा? How much is this diameter? 9.5. Very easily delivered. Right? Very, very easily delivered sub-occipitophragmatic diameter. Is that clear to all of you? Yes? So two diameters which you are going to remember for me. Number one, and these are AP diameters. We are not talking about transverse diameters. Right? We are talking about anterior-posterior diameters. So what is the diameter which comes into play in bro? Mento. कितना होता है? 14. That is why you have to do C-section. Right? Then when head of the baby is fully flexed and it is vertex, sub-occipitophragmatic diameter. And how much it is? 9.5 centimeters. Right? presenting part. Now understand, if this is how the baby is present inside the mother, I will say that lie is longitudinal, presentation is cephalic, presenting part is अब चाहे बेबी थोड़ा सा ऐसे क्यों ना हो, then also I'll say the same thing. Lie longitudinal, presentation cephalic, presenting part vertex. थोड़ा सा ऐसे क्यों ना हो, then also I'll say lie longitudinal, presentation cephalic, presenting part vertex. This means that still I can't tell you how exactly the baby is lying in the mother's uterus, right? So in order to tell you exactly how the baby is lying in the mother's uterus, we are going to take help of two more terminologies. What are the terminologies? Number one is denominator. What is denominator? Denominator is the bony point of reference on the presenting part. Right? So vertex में bony point of reference is occiput. Right? Face में bony point of reference is chin या mental. Right? Chin का दूसरा नाम होता है mental. Right? Then breech में bony point of reference is sacral. Right? So we are talking about bony point of reference. Bro में bony point of reference is frontal frontal. So denominator is the bony point of reference on the presenting part. Right? Now comes the last terminology which you have to remember, and that is position. Right? Position is the relationship between the bony point of reference and mother's pelvis. For example, now you have to hold this. Here. Right? So, what is denominator? Denominator is bony point of reference. Now we are talking about position. Position is the relationship between bony point of reference and mother's pelvis. In mother's pelvis, this is the anterior part, that is pubic symphysis. This is the posterior part, that is sacrum. This is mother's left hand. This is mother's right hand. Right? Now, if you see that the baby is like this, the occiput is lying. I want you to zoom in a little. Can you please zoom in? Yes. If you see that the occiput is lying directly behind pubic symphysis, you say it is direct occipito-anterior position. What do you call it as? Direct occipito-anterior position. The occiput is anteriorly and it is directly behind the pubic symphysis. So you call it as direct occipito-anterior position. Right? If you see that the occiput is posterior, it is lying against the sacral promontory. So you are going to call it as direct occipito-posterior position. Have you understood this? So what is DOA? That is direct occipito-anterior, and this would be direct occipito-posterior. Right? Now if you see that the occiput is midway between pubic symphysis and sacral promontory. Right? So suppose occiput is like this. Midway between pubic symphysis and sacral promontory. Neither it is anterior, neither it is posterior. बिल्कुल बीच में. Right? And it is facing towards mother's left hand. So you call it as left occipito-transverse position. What do you call it as? Left occipito-transverse position. Right? Now, so now I'm going to explain. Have you got an orientation? Now imagine this is pubic symphysis. I am sacral promontory. This is my left hand. This is my right hand. Right? If I see that the occiput is directly behind pubic symphysis, what am I going to call it? Direct occipito-anterior. If I see occiput is directly towards the sacral promontory, direct occipito-posterior position. If I see that the occiput is neither anterior nor posterior, it is in the midway and it is facing towards left hand side. So it is left occipito-transverse. Right? Similarly, if I see that it is neither anterior nor posterior, it is midway and it is on the right hand side. So it will be called as right occipito-transverse position. 4 positions you've understood? Right? Now suppose if the occiput is slightly tilted like this. It is anterior, but it is not directly anterior. And it is towards my left hand side. So it will be left occipito-anterior. Left occipito-anterior. Similarly, if it is like this, right occipito-anterior. Now suppose it is like this, right occipito-posterior. And it is like this, left occipito-posterior. Now we are going to do it again. And you are going to, go in a clockwise manner, starting from this position. It is midway. Left occipito-transverse. Then left occipito-anterior. Now direct occipito-anterior. Now right occipito-anterior. Now right occipito-transverse. Now right occipito-posterior. Direct occipito-posterior. Left occipito-posterior. Have you understood?
Yes.
If you've understood this, please understand that the most common position during labor is LOT. And then it goes in a clockwise manner. So most common is LOT, then LOA, then DOA, then ROA, then ROT, then ROP, DOP, LOP. Right? Please, another thing which I want you to understand. What do you mean by transverse lie? Transverse lie means कि पूरा का पूरा fetus is lying transverse. What do you mean by LOT? LOT means lie is longitudinal, presentation is sympathetic, presenting part is vertex, occiput is in occipito-transverse position. Right? So LOT position is the most common position during vaginal delivery. Don't say कि LOT में cesarean करेंगे. LOT is vaginal delivery. Right? Transverse lie में पूरा का पूरा baby ऐसे. Are you understanding the difference between LOT and transverse lie?
Yes, ma'am.
All of you? Yes? So the most common position during vaginal delivery is LOT position. So have you understood what is lie?
Yes.
What is presentation?
Yes.
Presenting part, denominator and position?
Yes.
Another thing. The last thing which I want you to remember is attitude. What is attitude? Attitude is the relationship between different parts of the fetus with each other. So normally baby के सारे parts flexed होते हैं. So the attitude of the baby is that of flexion. Right? So attitude, what is attitude? Attitude is the relationship between different parts of the fetus with each other. Is that clear to all of you? Now understand. If this is clear, a very, very important concept which all of you should remember whenever you are attempting image-based questions to identify the position. And this is the most commonly asked query on Instagram from me. Right? So for that, I want all of you, पहले mother की delivery position बनाना